Well, Manny, that was kind of a brief summary of cannabinoids, although we covered a lot of topics in depth. Do you have any comments you'd like to make before we start the Q&A?
No, it just only that it is a lot of information when it comes to terpenes. It is kind of like a secret sauce and is very individualized or can be. So with the Q&As, as I was looking through some of them as they were pre-submitted, I think we're going to answer a lot of questions that help a lot of people.
Okay, great. Well, let's jump into some of the questions that were submitted prior to the webinar, and we'll jump into those. So, quick question. Our first question is, my usual sativa product is suddenly giving me terrible anxiety. What are the correct terpenes to not cause this? Manny, you want to take that one?
Sure. So the sativa category is actually a hard one to tackle because most, from my experience, like to go with the hybrids to the indicas because it's more of a body effect. When you're dealing with sativas, it can be very racy. And one thing I want to point out right off the cuff is that sometimes when you find a product that works for you very well, if it stops working, is less effective or overwhelming, like as you're suggesting, then I would suggest trying to choose a different product. Your body is going to adapt to any product that you actually intake. And once it finds its balance, its homeostasis, if you will, through the entourage effect, your body no longer needs that same dose or that same product. So we just got to find something to sustain it. Typically in sativas, what I would say to avoid is if you're getting that distress effect, avoid limonene with alpha pinene. The combination can actually be overwhelming and make you very excited. It can cause a rapid heartbeat. It can make you really think fast and become overwhelmed as you're suggesting. So I would avoid that combination.
Yeah, I think I agree that the pinene in the product might be the one that's causing the issue, and it's something to clearly take a look at. And also, I think lean towards like the linalool type products, lean to the ones that are more sedative to be able to really cut down on the anxiety. I think that would help a little bit. Let's jump into the next question. And the next question is it possible to purchase isolated terpenes and add them to tea, coffee, or cannabis flower? It's rough to find sleep terpenes in a product. Interesting question, because the issue of being able to buy terpenes by themselves, like isolates, a lot of dispensaries do sell isolates. Is that correct, Manny?
They do, but not so much terpene based. They're more of the cannabinoid based, meaning your THC, your CBD, CBN, and stuff like that. Not so much on the terpene side because they're so volatile and they're very hard to extract, as mentioned in the presentation, particularly cannabis derived terpenes. But to that point, you can order them. I would feel comfortable suggesting it because you're actually leaning towards an ingestion rather than an inhalation. I would say be very cautious if you're trying to source them for inhalation. But your body has the kidneys, it has the liver. As long as it's sourced properly, you can add particular terpene isolates to products, to teas like coffee and edibles to make your experience a little bit more pleasurable or more effective.
And there are quality terpene vendors out there too. There's like 5 or 6 really good quality vendors that can provide the terpenes that you're really looking for. I should also point out there's a whole new trend coming into play where people are buying THC drinks, or more importantly, a lot of the dispensaries are now selling products that you can put into a drink. I know I went to a couple of dispensaries that are offering these products now. Have you seen any of those, Manny, where you can actually add to your drink a cannabis product?
Absolutely. I've seen it through a few different dispensaries. I believe Air does have it as well, where you can add it to your coffee. They have powders. They have almost like syrup-like type products. But to that point also, Mark, I do want to point out when you're looking at terpenes, you're really looking at a minuscule percentage that really packs a big punch. You're looking somewhere between 2 to maybe 10%. So you may want to consider the right recipe of the entourage effect with the terpenes, flavonoids, and your cannabinoids, so you're getting that better effect rather than spending more money on isolate terpenes from a reliable source.
Yeah, no, I think that's important to point out. We talk about. I gave an example in the slide deck. We have 6% terpene profile. That's pretty high for a product. Normally we see 2 or 3%. So be very careful with the terpenes. You don't need a lot of them to get a lot of effect. I think that's a good point to be.
Absolutely.
Next question: is it possible to exploit cannabis terpenes while minimizing the THC high? How can this best be done? This is really the magic and really the whole objective of medical cannabis. You want to take a first spot at that one, Manny?
Okay, so yeah, it's actually right there in the slide. Higher ratio of CBD. CBD naturally inhibits the euphoric effects of THC. So a 1-to-1 or maybe a 4-to-1 with the CBD ratio to THC with the terpene profile that you're looking for. And I know just about every dispensary has products like that in
Hmm.
vapes, which is inhalation, orals, which is going to be your edibles and sublinguals. It's about finding that right recipe.
I think it's important. The answer is yes. In fact, that's really the magic of what we're trying to do. We're trying to give you the maximum medical value by minimizing the THC high. And I think, again, using the right dosing formula. And by the way, I'm going to throw a shameful quote, a promotion for our dosing webinar, which we're doing next week. We'll be talking about how to actually do that, how to actually do your dosing so that you can find that medical value with a minimum amount of high that's really out there. So
And
the answer is yes.
keep in mind on that also when you're actually using a higher CBD product with the same terpene profile, so you're minimizing that euphoric effect. It may take me a few days to a couple of weeks for it to really become effective because CBD has to be built up into the system, whereas THC goes straight to the receptors, your CB1 receptors through the spine and the brain, which makes it that much more effective and euphoric.
Next question is a very good one. And the question is, are there terpenes that can assist with chemotherapy and provide some energy? I think I mentioned during the presentation RSO, which I think is the best possible product for cancer. One of the reasons for that is because being a full spectrum product, what you're able to do is you're able to use all the cannabinoids, all the flavonoids, and all the terpenes, which means you're getting the medical value that you really need. Your thoughts on that, Manny? I know that I'm pushing RSO as a first part of answering the question. I want to do some other things to answer it as well. But I think especially for let's just say easing the effects of chemotherapy, I think RSO is a pretty good product for that.
Absolutely agree. In the sense also that it'll help carry the terpenes more effectively than if you
Mm-hmm.
had a distillate, if you will. So in looking for energy, again, be cautious. Most will direct you towards limonene and alpha pinene. The two
Mm-hmm.
can be very energetic, but it can also be very overwhelming. I like
Mm-hmm.
to suggest a formula, if you will, of limonene, either
Mm-hmm.
first or second on your terpene list, and then B-caryophyllene, definitely first or second in there because that's going to act as your analgesic,
Mm-hmm.
as your pain relief. The limonene is going to give you the uplift that you're looking for. And then you're going to find alpha pinene somewhere in there, usually fourth or fifth, but you don't want it in the top 3 or 4 because that's where that combination could be too much. But the rule of thumb, as we always say, start low, go slow. If you microdose and find your sweet spot, then you'll know where you want to be and the comfort where you're getting that energy without the overwhelming or anxiety feeling.
Yeah, I think that's important. I know that when you're looking at offsetting the effects of chemotherapy, because chemotherapy can be very draining on the body. What you really want to do is you want to be able to use, I would say, almost some sativa type of products. Is that safe to say?
Yes, and I would go hybrid leaning sativa specifically because you don't want to get rid of your appetite. Most are trying to get that nausea away and get their appetite and consume something.
Sure.
And hybrid leaning sativa is going to have the beta caryophyllene that's going to help relieve the pain. It's going to help the stomach because you have a lot of CB2 receptors there. And beta
Right.
caryophyllene is the only known terpene so far that actually reacts with our CB1, CB2 receptors as well. So
Right.
limonene and B-caryophyllene are my top two again in that formula.
Next question is, how can men manage edible doses to meet an individual needs? Strength, time, and effect. Many edibles are very effective at being able to address a lot of different conditions. I think what you're really looking to do is getting an edible that has the terpene profile, but also one that potentially is not just a THC based edible, but also one that potentially has some CBD in it. Your thoughts?
Absolutely. Edibles are a little bit more difficult, if you will, and it requires more attention to detail when you're trying to find your dosing on edibles because a lot of things come into play. Whereas inhalation, you inhale and within minutes you feel it. Edibles, orals, kind of depend on your digestive, your metabolism, if you will, your first pass effect. So it has to be metabolized, it has to be processed, and then you also got to make sure that you're getting the proper product. I get a lot of instances where somebody would say, well, I only took half of this and it was great. And then I took a half the next night, it was too much or too little. You want to make sure you're getting something that's evenly titrated throughout. There's certain products out there that are already partitioned for you because that's where the dose lies. I wouldn't split a partition unless it says you can do so. It also depends on it. Did you eat? Are you being active? Are you going to sleep? All these play a role in how this product's going to affect you. So getting that one-on-one consultation, whether it's at a dispensary, which they have to offer them to you, they even have private rooms for you if you want more privacy. Get that one-to-one, spend some time, get some note or some registration documents where you can track your progress so that way you know how to fall back and not have to guess, particularly when you're shopping back for more product.
Right. I think that's a good point. I think what Manny's pointing out is all the dispensaries, at least here in Florida, are required to be able to provide consultations to you, and they're free, by the way. And so what you may want to do is if you have a favorite dispensary that you're getting your edibles from, go talk to them. What they'll do is they'll talk to you about the products. They'll talk to you when you're talking about what your objective is, let's say strength or time of effect. They'll take you through all of that because they're very versed in their particular set of products. The guidelines we have here are general guidelines, but the specific products they'll know about that's really out there. And I think people really don't take advantage of consultations that much, do they, Manny?
Not as much as they used to pre-COVID. Before COVID, it was a lot more available because you could get close, you could get personal, and then COVID came in and it kind of changed the game for everybody. But that doesn't mean it's not available anymore. It's still there, it's still available. A lot of them at the dispensaries are very eager to share their knowledge. They're subject matter experts in their field, but they're not medical professionals. So be cautious with that. Don't try to explain your diagnosis. Try to explain how you're trying to feel because of your diagnosis, and they'll be better able to direct you with the products they have available.
Yeah, that's a good point. That's an excellent point. Let's look at the next slide. What can I use for constant severe pain? Pain is one of the main reasons people use cannabis. I know it's one of the reasons I use cannabis. I have 7 herniated discs in my neck and 2 in my back. Plus, being a senior citizen, I have the ambiance of two knee replacements. So severe pain has been something that we've got a chance to meet. And I've used medical cannabis effectively for years to keep my pain level below a 1 constantly. And I have a regime to do that. And by the way, next week in the dosing seminar, I'm going to talk about that. But Manny, let's talk about severe pain because cannabis has been very effective to do that. And I think there's a couple of products like caryophyllene and myrcene that really people should pay attention to.
100%. And this is a little bit of a double-edged sword because anybody who's dealing with severe pain and uses medical marijuana, I'm pretty sure you're really hard up leaning on the hybrid to indica, if not full indica, because they're more body effective. However, the downside to that is your body's more relaxed, if not drowsy. Therefore, you're not as effective in getting things done that you need to get done. However, there's an answer to that. What you want to look at is that you don't have to just use one product or one route of administration. If you're comfortable inhaling, you could use an inhalant with a topical. You could use an edible with a topical. There's different mannerisms of where you can find that benefit so you can still be functional during the day when you're at work rather than sitting in pain in class or at work and have to wait till you get home to get to that relief. And I think that's what you were describing, Mark, when you have a regime, a certain methodology, if you will, on how to take your medicine throughout the day rather than just at the end of the day, you find that better quality of life.
Yeah, I think you're talking exactly it. The regime is how do you get 24-hour coverage? When I wake up in the morning, I hit a vape pen, which works instantly. In other words, within a minute or two, my pain level goes from a 7 or an 8 down to a 1. I then use a tincture that will carry me into the early afternoon. But then in the afternoon, I've got to do something else. So I use a tincture or a gummy, depending on the day and the workload that I have. That'll take me into the early evening. And then from that, I use basically, that's where I use a vape pen. And then before I go to bed, I usually take some sort of an edible. My favorite being, I have either I use chocolates or, for example, I have my magic brownies. So it's not just in order to manage your pain that's constant, you've got to have a regime that goes for 24 hours. I think that's one of the most important things. And the second thing is I make sure that every one of the products that I use and the cannabis products that I use lean on the caryophyllene, the myrcenes, that type of, because I think those are, especially the 2 terpenes that I've found that have been very effective to help me. That's really there. Using that, it'll work. I know that, look, I had knee replacement surgery done. and I worked with Jewett Orthopedic here in Orlando, Florida, and I was their test case for using medical cannabis post-surgery after I left the hospital, because I can't use it in the hospital. And I used medical cannabis rather than taking Percocet or anything else. And I kept my pain level below a 1. And I think that's really, really important. But I had worked with MMTC of Florida to come up with the plan. I'd come up with my dispensary, I'd come up with the right kind of products. And then candidly, every week I was adjusting it so that I could be able to pay attention to my particular situation. For example, I found out that if I concentrated on inflammation, like for example with my knee surgery, if I reduce the inflammation, I reduce the pain. Taking more products that address pain only didn't necessarily get rid of the pain long term. It did short term, but not long term. Using CBD allowed me to relieve that pain, that inflammation pain that's there. So you have to really pay attention to what's causing that pain. If you have an injury, if you have an operation, or some sort of something where you've some acute type of a situation, you may want to pay attention to using a little more CBD. You'll be shocked at how well it works by relieving the inflammation. Are your thoughts on that, Manny?
Completely agree. I couldn't have said it better, Mark.
Yeah, I think that's really important. A lot of people just focus right in on, I'm going after the pain stuff. I know that when I had my knee operation, I was going 1 to 9, 1 part CBD and 9 parts THC. I found out when I almost reversed that, I got better effects than that, because I needed to reduce that inflammation. And the doctors were telling me the more I could reduce the inflammation, the better it would be for both not only healing, but also for the pain itself. That's something I just want to point out. It's something that's really there. Next question is one. It's really interesting. Is one here? Have you heard of therapy, or terpene therapy? And the answer is yes, I have. In fact, I have a very good friend of mine who's down in the southern part of Florida, Sherry Kaplan, and she actually does do terpene therapy. It actually uses. It's a kind of a cross between medical cannabis and aromatherapy. And they be able to use this to be able to address your particular condition. And there are practitioners that are very good at that. I know Sherry is one of the people that I work with on this, and she does a great job of identifying your situation, coming up with the therapy, and it's a very, very relaxing and very, very, how should I say, effective therapy that's out there. However, there aren't a lot of people that do this. I probably know 3 people across the United States that do this effectively. That doesn't mean it's not available in a lot of places. It's just I don't know of a lot of practitioners that really know this in depth. So the answer is yes. And it's something, if you can find someone in your particular area, if nothing else, just talk to them, see what they have to say, because they may open yourself to an avenue that can really help you with your particular situation. Now, I do know that when they do this, they also sometimes they use either hemp-based products, or they use a medical marijuana product that's out there. So just be aware, it's not just by itself. Terpenes may be used with other things in their therapy, depending on what they're trying to do. Terpenes are so fragile. Delivery and bypassing the liver is critical. Can you talk about suppositories? Well, suppositories are extremely effective. I know they use them. They were developed for senior citizens. They were developed for children. And they were developed for patients that were hospitalized. I know that they aren't necessarily a popular product that you find in the dispensaries, but I know in Europe they're very, very popular, because they're able to get the cannabis directly into your liver, into your bloodstream much faster and much more effectively than a lot of other methods that are out there. Again, a lot of people here in the United States aren't necessarily attracted to that kind of product, and so that's why the dispensaries don't sell a lot of them. They don't carry them. But I do know in a lot of medical conditions where I've worked with the doctors, for example, in Oklahoma, Dr. Sandy Sandbar and the rest of them, they use these products, especially as they mentioned, for patients that are hospitalized or patients that have been senior citizens, and they work very, very effectively. The Israelis have a big study on this, and something you may want to take a look at. It's in PubMed, and they found it to be very, very effective for a lot of different patients, especially patients that have been coming out of a war zone, that are in the hospital, that need some help. And cannabis has helped them with pain and helped them with inflammation, and also with the PTS. So it's something you may want to take a look at. Again, they're not popular. Sometimes they're hard to find, but they are very effective. And I hope that answers your question. How can I get the maximum terpene benefit from vaping and the temperature settings? Well, we provided a chart, and I really think we want to go back, sometimes go back. That chart will be provided for you in a follow-up email. But what you really want to do is pay attention to that, because there's a low, a medium, and a high setting for vaping. And I think that's something that is very, very important, because by matching that, you're able to bring out the best of the terpenes without burning them off. And Manny, I did something that I really shouldn't have done. Did you have anything you wanted to add to the suppository discussion?
Oh, not particularly, but just to reaffirm, you're right. The dispensaries did have suppositories for a while. They kind of got rid of them. I'm not sure. I think there might be one or two more that adds it out there.
There's two
But
of them, yeah.
more importantly, I'm really impressed to see the question or the statement that terpenes are so fragile. They are very, very volatile to the point where by the time they hit the stomach acid destroys about 99% of them. So
Yeah.
that's why we try to tell people if you're using a sublingual, even a chocolate or a gummy, you want to kind of chew it up and let it sit under your tongue, or, not
Good
necessarily
point.
push it around, but you want to get it through your sublingual mucosis so that way it's effective. You
Yeah.
don't want to just swallow it down. So
Yeah.
thumbs up to that. And then I did have a fun fact on the terpene therapy, Mark. If you didn't know, terpene therapy is already around you in marketing. That's why your cleaners have that citrus scent to it. That
Yeah.
is to get you uplifted, and so you get cleaning. When you walk into certain spas, they are diffusing lavender, which is linalool. It helps you
Hmm.
relax. So there's terpene therapy all around you. To even in nature, if you walk out in the woods, especially if there's a lot of pine trees, alpha pining, you get that clarity, that uplift. So it's all around you. It's about harnessing it and figuring out to make it more beneficial to you.
Yeah. No, I think they've been used. Like I said, it's an offshoot or a version of essential oils. Is the best way of putting it.
Mhm.
That's really there. I was in the middle of answering vaping and temperatures. You got some comments about that, Manny?
Just again, reiterating, the temperature makes a huge difference. My particular regimen when I'm using vapes, or even if I'm vaping flower, which we'll probably get into more in dosing, is always going low. I get a nice little uplift without the overwhelming effect of euphoria. It doesn't last as long, so I'm able to do it first thing in the morning, kind of what you do for your regimen, Mark. And then as I go throughout the day, or as my pain increases, then I raise the temperature a little bit more to medium. That's where I think or not think, almost know, is that B-caryophyllene is evaporated and inhaled. So that's more of your analgesic and pain relief. I don't often go too much into the high temperatures unless I'm getting the last bits of my flower that has already been vape. But other
Yeah.
than that, I stay pretty much medium to low.
Yeah, and I usually stay in the medium category because I'm really looking for that inflammation. I'm looking for, especially the caryophyllene and things like that. But the thing I think is important, people don't realize that you can set the temperatures, the low, medium, and high. And they buy a pen and they just use it. If you buy a pen that does not have a temperature setting, by the way, it's set on high. Just I'll let you know. I did some testing on that and found out that that's where they were at. So I prefer to get it. You can get the cost between one that has no setting and the three settings is just $1 or two. It's not very expensive, right, Manny?
If that much, yeah.
Let's run to the next question. I think it's a good question. It says, what are the best terpenes for peripheral neuropathy? I have hyperthyroidism. Well, first of all, neuropathy is something where basically the sheath of your nerve has been damaged. It may be compromised to the point where it's really very sensitive. And so it's not only just a matter of using the right terpenes, but also you really want to pay attention to using also a lot of CBD, or pay attention to CBD, because what you want is a product that is a neuroprotectant, something to coat the coat as well. But I think, Manny, you want to try this one? Or you want me to try? You want me to answer it? I don't want to be
I was
dominating.
going along the same route. I was just going to suggest maybe routes of administration, high CBD product, patches might work depending on how severe your peripheral neuropathy is. If it's
Mhm.
just the feet, just the legs and arms, depending, a patch may be beneficial. A salve or a lotion may be beneficial, but always start with just a little bit. You want to make sure the other ingredients that are in these topicals aren't going to affect your neuropathy in a negative way. And that's because some of them will carry eucalyptol or some other agent, a natural agent, to help get it into your skin and into your pores a little bit more rapidly and more effectively. So always
Mhm.
test out a little bit on a sensitive spot, see how it works, and then progress from there.
Yeah, and I think they answer the question directly. Caryophyllene will work great. Myrcene will work great. And linalool are the three that I recommend. Are the top three that I recommend to pay it to address the neuropathy
With high CBD.
with high CBD. Yeah, at least a 4-to-1 for CBD, 4-to-1 to CBD. It works very effectively, but also it takes a day or two to work too. It's not like a pill that you take and immediately works. It'll take some time, but it does that get that neuroprotective capability. The time to just neuroprotect. Let's put it that way. Next question is: are there terpenes that might be implicated in severe neck tension? I may have chronic flare-ups after consuming medical marijuana. This may be an issue, by the way, Manny, where when we talk about the dosing, you get to a point where you use medical cannabis, you use a little bit more of it, a little bit more of it, you find your therapeutic dosing level, you find where it works. And then if you keep adding to it and you keep going the other way, it brings back, it's biphasic. It'll bring back the problem. It sounds like this may be that situation.
I was kind of leaning the same way. I would have to ask more in-depth questions, such as, are you using a high THC product? What's
Mm-hmm.
the route of administration? Is it inhalation? Does it occur immediately after? Does it take time? What environment are you in? These are all the type of questions that show just how personal medical marijuana can be with one
Right.
individual. So, but I would suggest the same thing. It sounds to me, and this is just based off of the little knowledge that I have here, that it's probably a sativa leaning product. We
Mm-hmm.
went a little bit over, as you stated, it's biphasic, so now it's bringing back tension and making it worse. So I would probably take a heavy dose or a good dose of CBD. What a good dose or a heavy dose would be at least a quarter of a dropper of a tincture. If you have a 1-to-1 vape, maybe 1 to 3 inhalations off your vape,
Right.
and that to help kind of relax that and calm it back down if it is a high THC product. But
Mm-hmm.
other than that, I don't know of any particular terpenes or combination of terpenes that would cause that tension.
Well, and again, every person is different. So, you can't. Doctors have the same issue. They suggest medications and they hope like hell it works based on this research. Same thing with medical cannabis. I know there's a lot of terpenes. I have 7 herniated discs in my neck, and there's a number of terpenes that I use to be able to relieve that tension. I haven't had the problem of going the other way, but that doesn't mean it doesn't exist for some people. I would think the best thing to do is use a little bit less of the product, and let's see if that goes away, because that might be your issue. You might have crossed that therapeutic dosing level and gone to the other side of the curve. Let's run to the next question. It says, what is the reliable source that one could look up the information about the cultivars terpene information? I think the best way to do that is with the COA. Your thoughts, Manny?
That is pretty much the only legitimate way you'll get a no fluff response. The dispensaries are not going to publicize the whole terpene list. They will provide you with the COA, which by law has to provide the whole terpene list. The ones that do have it on the website will list the top 4, maybe 5. And with those top 4 or 5, you can make a significant informed decision on which product is going to be beneficial.
Mm-hmm.
But yes, the only legitimate way to see what the whole terpene profile is on a cultivar's product is through the certificate of analysis that's provided through the dispensary. And it is third party tested as well, not just the state, but also third party tested.
Yeah, I think that's important. I think the COA is going to be the best answer to that particular question. And again, every dispensary has to provide one. And you may have to click on the website, download the PDF, but it is there to be able to pick it up. That's
And a
good.
little trick, if you really want to see the legitimacy, I could vouch for a couple of dispensaries that I work for or shop at. However, I'm pretty much certain that all the dispensaries are on par because they get randomly selected for inspection by the state. If you're really particular on a product, ask for that COA. In about a month or two, when you're getting that same product again, ask for that COA again, and you'll notice just on the label of the product itself, there's a slight percentage difference in the THC, CBD, and or the terpene profile, and that's because this is a live product. It's not going to be 100% the same every single time. However, that small slight percentage change can change the effect on how it works for you. So just keep that in mind as well.
Let's jump to the next question. It says, does a comprehensive resource exist that lists terpenes for a significant number of products offered by dispensaries and where? Manny, I'm not aware of any. Are you aware of any?
No, there's a couple of attempts. They don't list the terpenes, but they'll list the products, more the sales of the products.
Right.
But the best thing you can do is, I know there's a couple of dispensaries you can actually request this COA. before you even purchase the product. You could always ask for the COA before purchasing a product on site or while you're at the dispensary. But other than the comprehensive resource, I don't think so. And it would be very hard pressed to find one because again, it is a live product. It's going to change from batch to batch, and they have to note that change, even if it's by 0.0001%.
Right.
So it's very, very technical and very specific.
If we find one, if you find one, by the way, let us know. I'd love to know where
Please
it's
do.
at. That kind of thing. The next question is, what terpenes help chronic back pain patients? Best strains for degenerative disc disease, scoliosis, and arthritis. Well, before we jump into what strain, and I should point out, when you talk about strains, it really, you can use buy the same strain. Jack Herrera in one dispensary is not Jack Herrera in the next dispensary is not Jack Herrera in the third dispensary. So you got to be careful about using the word strains. I would pay attention more to the terpenes that you want, and I'd also pay attention to the fact, like for example, I have a herniated disc in my back, and I have arthritis. I pay attention to using a high profile or a lot of CBD as well, because CBD helps release the inflammation, especially in the herniated discs in my back and my arthritis, and that helps to relieve the pain. And I think that what are the terpenes that are great for that? Again, we go back to the caryophyllines, the myrcenes, those kind of products. Your thoughts, Manny?
Completely agree. I would just add in there the routes of administration. Double up, use a patch, use a topical along with an inhalant or an edible. You want to titrate the edible with the inhalant to make sure you continue that. If you're using those routes of administration, you can continue that relief that you're seeking. But other than that, yeah, spot on, Mark. Just the route of administration is the only thing I would add on there.
I think you're right. I think people overlook, especially for arthritis, people overlook topicals. And I think that's something to really pay attention to. And I found a crazy product called Blue Emu. I don't know if you've ever heard of it. And and they have a hemp version of Blue Emu. It is all terpenes. I'm really shocked. Actually, a doctor recommended me to look at it. And I am, again, people say, can you get a product that has a lot of terpenes in it that helps you? Blue Emu is one of them. I think it does a great job I know it helps me with my arthritis.
Yeah, and I would be remiss if I didn't say, but I will say very cautiously. I even go as far as taking products like Blue Emu and adding some of a cannabis derived product from a dispensary to make it a little bit more effective, because I want more of that particular cannabinoid, which is CBD or specific terpenes along with that. And I find it to be more effective. It can also be a little bit where I'm manifesting this myself. That does occur if you are putting yourself in a bad mindset, particularly if you have PTS or PTSD, and you take a product, it can really bring that flashback back. And I talk from experience on that. So please go cautiously with that.
Yeah, but you stole one of the tricks I use, which is I do use Blue Emu with a lot of the balm products that I get from dispensaries. Like for example, the one I use from Air. I'm a senior citizen. I'm into martial arts. I walk between 3 to 4 miles a day to stay in shape for my martial arts. And when I come home, I use a topical. I use Blue Emu, and I use a cannabis product, like for example the Air Balm, together, and I found them to be more effective than using Blue Emu by itself. So I've done both. I'm like the lab rat, the guinea pig that's out there, but I found it does work very effectively, and hope it's something that's there. The other thing you might pay attention to is RSO is really a catch-all product. It works great. When I'm in a lot of pain, when I have worked out, been practicing for a tournament or something like that, and I'm in pain, man, I just go right to RSO. It's kind of like my go-to product. Your thoughts, Manny?
I would agree. And if you are considering that or having trouble with that thus far, please tune in for our dosing webinar, because RSO is one that you would want to test out on a day off when you could be home in a safe environment, and find your therapeutic dose. So that way you can maintain that when you're actually out in public or doing what you need or want to do.
Yeah, it's the 151 Bacardi of the cannabis world. It's strong, and I use it mainly in the evenings after I walk, when I'm going to watch TV, before I go to bed. But it does relieve the pain, and it does help a lot with it. And again, I have not just back, but herniated discs, and that's instant pain, man. I'm telling you, it's if I don't pay attention to it, when I take my holiday, for example, I take a break. You'll find, like, you're supposed to take a 4-day break. I take about a day break, maybe a day and a half, and then my neck taps my shoulder and says, if you don't do something pretty quickly, I'm going to let you know I'm here. So it's something that I do pay attention to, and something that you may want to do. The combination of terpenes and the right products, the right routes of administration really can help you with that particular situation. Manny, let's run into some questions from the audience that they brought up. I think the first one is right up your alley. Is the COA available on dispensary sites on all products?
I haven't checked recently. I know about maybe 2 months ago because I'm very particular about my shopping as well. Not all of them will have the COA. Some of them do, where you could click on the link and you can actually download the COA. But again, it's very hard to maintain that. That's a whole nother job for 6,000-7,000 people, if you will, throughout the state that would have to maintain that for all the dispensaries. Not to say that they shouldn't. It would make life a lot easier for a lot of us if they did maintain that. But most of them will list, again, the top 4 to 5 terpenes. And from that, you can make an educated guess. So when you go in, you know what you're looking at. And then you can ask for those specific COAs instead of actually shopping by COA for every single product they have there. I hope that wasn't too much.
Yeah, I think it's something. Most of them, I know, and I work with almost all the dispensaries, and they're working very hard to make sure that they have the COAs out there. They know the importance of that, both legally as well as the convenience for the patient themselves. So ask for it. I think the best thing to do is just ask. Don't be shy. Tim asked a good question. Typically, what concentrates can contain highest terpene content? I think you're talking rosin and resins. Randy, what's your thoughts?
Yes. But you also got to maintain that the route of administration is going to be the most important, because if you have a rosin or resin that's very high, but you're taking it orally, sublingually, or topically, you're not going to get the benefits of all those terpenes unless you're really holding it under your tongue or in your mouth. Because as soon as it hits the stomach, those terpenes are going to be destroyed. Inhalation is the most effective and carries the most efficacy, if you will. However, it's also going to be the shortest lived. It's not going to last as long as if you took a smaller dose of those same terpenes in a route of administration as an edible or oral.
And you have to pay attention to the, when you do that, pay attention to the temperature setting too.
Correct. So you want to stay low, medium. I want to go above medium if you're doing an inhalant, or you could say vaping flower, because a lot of people would suggest, well, then if I burn a joint or if I'm actually combusting my flower through a water pipe or whatever it may be, well, that's the highest temperature. But you're also getting the highest concentration of those terpenes as well, because those trichomes are in abundance on that flower, which is what's making it as effective. Whereas in a vape or a product that's been derivative of the flower, it's very specific. You don't have that abundance as you would on the actual flower.
Right. I should also point out hash is very high in terpenes.
Absolutely. Hash is basically all trichomes pressed, and it's all the benefits of the terpenes based in that trichome profile.
A lot of people at least a lot of people say, and I agree with them, one of the best ways of using cannabis is hash. I just love it. But again, and really, the terpene profile is really there. The thing about hash is it's not easy to use. Let's put it that way. It's something that's there. There's a little trick to it. So people just don't jump right into it. I've had to go through a little learning experience on that, but it does work very well. Next question that Keith has is there any product without terpenes or added stuff? Yeah, I think there's a number of products out there. There's a lot of what I call isolate products without terpenes.
Yeah, actually, you just go in and ask for isolates. And basically, you're going to find maybe 3 different isolates: CBD, CBN, and THC in pretty much all dispensaries. Actually, CBN is a little bit between certain dispensaries because it's a little bit harder to maintain. But you can find CBD, THC isolates. You won't necessarily find any terpene isolates at dispensaries. It just wouldn't be cost effective for any dispensary to do. It would cost you way too much to try to maintain that regimen on a terpene isolate rather than sourcing it outwards, particularly because it's legal to have terpene isolates, whereas everything the dispensary sells, to include lighters, rolling papers, you would have to have a license to purchase those terpenes, even though you could get them somewhere else without requiring that license. So it just wouldn't be cost effective. But as far as CBD and THC, yes, you could get those in isolates at dispensaries.
And the isolates are the answer there. Just ask for an isolate, and that's what's going to get there. And they typically, and again, all the isolates sold in a dispensary will have a COA, so you can see if there's any added stuff that's in there. That's really important. Question that came from YouTube, which is great. What's the best medical cannabis for migraine pain? Manny, I'm going to have you jump on this one because this is a subject near and dear to my heart. I have some family members that have migraines. But I think the thing I found is I just found a recent study that was done in Israel and one that was done also in Canada that's found that cannabis is extremely effective for migraines. In fact, I was surprised how well it worked. Manny, your thoughts on this? You have some terpenes, or what do you think the best
No,
approach is?
100%. I actually suffer from migraines from time to time, unfortunately. And when those do set in, basically, I hit it from two sides. I take a topical. I have two topicals that I like particularly. One is a blue, I call it blue, and I mix it with a one-to-one tincture called Soothe from Certera. And I would rub that on my temples here. I would
Mm-hmm.
also inhale possibly a one-to-one product that's high in B-caryophyllene
Mm-hmm.
and a little bit heavier on linalool, lighter on limonene, so I can relax. I'm not trying to be active after recovering from a migraine, at least not right away.
Mm-hmm.
So I go two ways. I use a topical right here on my temples. You want to make sure again that the byproducts like eucalyptol is not too heavy. Otherwise, you get that little stinging sensation in your eyes because it's a little bit too strong. It won't hurt you, but it's a little uncomfortable. And then I also inhale the product. It seems to be
Mm-hmm.
very effective. But to answer the question, terpene wise, linalool, myrcene, and B-caryophyllene would be the profile I'm looking for in the top three.
Yeah, I think that's great. That's a good point because I know that it has worked very effectively, and you're right. Starting using the one-to-one product, and I think it's surprising they're finding out that CBD is very effective for it.
Absolutely, and it actually leads me to my little cliche, if you will, the verbiage I use to describe that entourage effect
Mm-hmm.
is imagine if you're going for an Italian a meal, the classic spaghetti and meatballs.
Mm-hmm.
Regardless of where you go, if we're together, we're going to get pasta from the same pot. That's your CBD, if you will,
Sure.
and meatballs from the same pot, your THC, if you will. And by itself, it'll sustain you, it'll feed you, it'll do what it needs to do. But what makes it special are the terpenes and flavonoids, which is the sauce. You have
Right.
red sauce, white sauce, you can add garlic, you can add other different spices, and that changes the whole palette on how you're going to experience that meal. And the same thing with terpenes. Having both, having that full entourage effect rather than just an isolate is usually more beneficial. That is not to say that isolates aren't beneficial, otherwise there wouldn't be a market for them and there wouldn't be people looking for them
Right.
that actually benefit from it. But typically it's going to have that full effect.
I want something that is high in THC and no adding stuff. I don't like stuff that's added to my meds. I have severe pain and I have a terrible neck and back problem, and I've had several operations and very, very bad neuropathy, my hands and feet. RSO is awesome. Your thoughts, Manny? I know that the RSO is awesome, but I think in this particular case, it's paying attention. Also, I'd augment the RSO with maybe a little bit more CBD, especially for the neuropathy.
Absolutely. And then to address the concern, I just want to make sure I'm clear, and if I'm not, I apologize, that there's no added stuff in any of the products that are sold at dispensaries. Everything that is in these products, other than, agents that help salves and lotions and stuff like that better absorb, is all natural from the plant. That's what the certificate of analysis shows. There's no heavy metals, no mycotoxins, no added byproducts. Depending on the extraction process, the alcohol is evaporated or the CO2 is evaporated, and that's all tested. So you're getting unadulterated product from the dispensaries, which is what makes them so
Mm-hmm.
beneficial. But as far as RSO, yeah, I completely agree. There are one-to-one RSOs or FSOs as described in the presentations that are
Mm-hmm.
out there as well. So you can find products that are not as euphoric as most RSOs are known to be,
Mm-hmm.
and cut that back a little bit so you could be more productive during the day if your tolerance is not available to manage those high euphoric effects.
Keith asked another question. Why don't my chocolates melt in my coffee? Even the gummies don't seem to melt in my coffee. Why is that? Is there something wrong with them? And is very hard to find brownies and cookies anyway? Do you know where I can find them? Well, let's talk about the first question. Why doesn't the chocolate and the gummy melt? I think it has to do with how they're made, right? With the ingredients that hold the chocolate together.
Yeah, absolutely. So there was a time where people were buying chocolates and gummies, and by the time they got home with them, they were already melted, or yeah,
Mm-hmm.
one gelatin ball instead of 20 or 10 gummies, whatever comes in the package. that you bought. So instead of using gluten, they switched to pectin, which is actually, from my understanding, more healthy for your body and to be digested. And it also has a higher boiling point. So that way your gummies and your chocolates didn't melt on your way home. So they're consistently doing research for things like that. The chocolates, for most dispensaries, are also very well sourced, and they're using more cocoa or dark chocolate rather than milk chocolate, which again has a higher boiling point. It's healthier for you. So that's possibly why, unless you really get your coffee boiling, it's not likely you're going to absorb that way. What I do suggest is getting the other options, the powders, the syrups, even adding a tincture. Now, oil, depending on the oil that it's based with, just about any oil will separate from your coffee. But if it's hot enough and you stir it, sip, stir, sip, stir, that's very effective. I do that quite often on my mornings. But I wouldn't be concerned that it's adulterated if that's your concern.
I would also say, Keith, if you put in chocolate, into your coffee, I understand the chocolate factor there, or gummies. I in the morning when I wake up, one of my regimes is I just take a little nug, a little teeny bud, and I drop it in my coffee in the morning. And that's how I start my day. And the reason I do that is because that 220 to 240 degree temperature of my coffee will take that nug, and it'll actually it'll warm it up, but it'll bring out the THCA, the CBDA, and the CBCA, but it won't convert them to THC, CBD, and CBC. In other words, I'll get the medical benefits of those products without the high. And that's how I typically start the day. And if the middle of the day I have some pain or inflammation, I'll get another cup of coffee and drop that bud in there. I think not a lot of people know that trick. And you might want to, Keith, you might want to pay attention to that. You don't have to worry about melting it. Just put the bud in itself. And by the way, you can eat the bud when you're done.
Yeah, absolutely. I actually do that with because I vape flower a lot now to be a little bit more health conscious. But I don't vape it all the way to where it's 100% brown. And what I do is I dump that in another little container. In the morning, I sprinkle that in my coffee when I'm brewing my coffee. Sometimes I'll sprinkle it on my ice cream if I'm treating myself, a brownie, something like that. And it's a very subtle effect rather than if you were to ingest a gummy or smoke a joint or take a couple of puffs off of a vape.
Yeah. I mean, consuming cannabis is not going to hurt you. And a lot of people do. And again, if you can get that where it's been warmed up to the point where it's starting to bring out the THCA, CBDA, and CBCA, you'll find it to be very, very effective. I swear by it. I mean, it works very well. In fact, I've made a tincture that way. I've used a magic butter machine where I actually make a tincture where I take the MCT oil and I actually cook it for 8 hours at 160 degrees, and it actually turns it into a tincture that does the same thing. That's something to pay attention to that's out there. By the way, I think cookies and brownies, sometimes I find them in dispensaries and sometimes I don't. I think that there's less demand for them, Manny, because I think, candidly, most people are making them themselves. Like I make my own brownies. Your thoughts?
Yeah, I agree. I don't see cookies or brownies too often anymore. I still see tons of chocolates. I know a lot of people do a lot of recipes with those as well. And that's probably why that demand is still there. But I haven't seen too many cookies or brownies anymore now that you mention it. The last dispensary I think I bought it from was maybe a year ago at Truly, but I haven't seen it since.
Yeah. Like I said, I'm a bad person to ask because I'm starting to make my own, like yourself. I found that cooking with cannabis is very, very effective. So my magic, in fact, my wife made me magic brownies today. So I'm very happy about that at this point in time. Next question is, Cheryl asked the question, which vaporizer do you recommend? Oh, Cheryl, you've got me in, now you've started, you've opened a Pandora's box. If I had to buy one vaporizer, one pen that I would use, it would be the Lynx product. I personally think that's the greatest product I've ever run into. It lets you get 4 settings. It lets you be able to put both 510 cartridges, meaning the vape cartridges that you buy. It also allows you to handle concentrates, and it's the size of a vape pen, which is great. It has a very long charging time, and it really doesn't break the bank as far as when you purchase it. It's in the $70, $80 range. So, and it's not it's more expensive than a pen you'd buy at a dispensary. But I have 2 of them, and I've used them for 3 years, and they're rock solid. And that's kind of, you asked me which one I recommend. That's it. Manny, your thoughts?
I agree. For me, this just gets a little bit deeper for me because when you suggest which vaporizer, are you talking about the actual product, as you suggested, a 510 thread, a pod? Are you talking
Yeah.
about the battery? For me, and I found when I'm dealing with patients, not just myself or consumers, excuse me, because I'm not a medical physician, that it's a mixed bag. I personally am not a big fan of anything bigger than a half gram 510 thread. For me,
Hmm.
they start turning brown too quick, which means they're
Yeah.
degrading into not bad for you, but just degrading. And that's usually because the temperature is hot, cold, hot, cold. It continues to heat that oil. And so by the
Right.
end of it, you're not getting the full benefits as you would when you finish a half gram. I'm more particular to pods than I am actual 510 threads. I find they don't get clogged as
Yeah.
much. They're a little bit easier to manage and they stay cleaner. When you're talking about batteries, I'm a big fan of the Puffco battery that actually acts as a three-level battery. At least the one I have. I haven't seen the newer ones. You could dab or use concentrates in it. You could add your 510 threads to it. So
Hmm.
it all depends on personal preference, what you're trying to
Right.
do, what you're trying to accomplish, how discreet you're trying to be, and the reasons why, for your personal
Sure.
reasons, of course. But these are all questions that a good consultation or consultant or advisor would try to ask you to get a better understanding of who you are and what you're trying to achieve.
Yeah. And I do think Puffco makes a great product. I still like the Lynx product better though.
I haven't tried
But
the links. I'm gonna look into it now. Every time
I,
you suggest something, Mark, I
I
dive
shocked. I
in.
was shocked by this thing. I also do want to point out when you talk about vaporizers, if you're talking about a dry herb vaporizer, and this is for if you it's at an alternate to smoking, you can get a dry herb vaporizer where you put your cannabis inside the vaporizer and it steams it, and it's a lot safer. It's like a vaping rather than smoking the cannabis. It's a lot better for you. Now I recommend two. One is Storks and Bickel. They're out of Germany. They're extremely expensive. They're the Mercedes-Benz of the industry. I've had one now for 2.5 years, and I love it. It's worth the money. Let's put it that way. And I think the other one, which I found recently, is one from a company called Planet of the Vapes. They've come up with a very good product, and it's not expensive. It's more in the range of you get a product for $70 to $100 for a dryer vaporizer. That's very, very effective, and their bubblers work really great. So in that particular area, there's some really good products that are coming out that's really out there. I think dryer vaporizers are kind of on the rise. There's more and more of them coming out. Manny, what do you think?
Yeah, I agree. Since you've mentioned the stores in Bickle, I got involved with them and I got the Venti, which is an
Hmm.
upgrade to their latest ones. I actually, my son and daughter are patients. They're grown folks now, but they're also patients. And I even bought them the mini VZ of the stores
Oh,
in
okay.
Bickles, and they absolutely love them. You get a more natural flavor from the flower.
Yeah.
The effects is the same, and the byproduct is semi baked flour, now decarboxylated, which you could mix with food, your coffee, or otherwise. So it's a win-win there. But I did want to suggest that, the most important part is that when you're vaping, you're not holding your breath. Same thing with
Yes.
smoking.
Yes.
Holding your breath really does nothing for you. You're actually getting that extra euphoric effect or dizzy effect, as I describe it, because you're depleting your body of oxygen, not because you're getting
Mm.
more of the medicine in you. And if you're smoking it rather than vaping it, you can irritate the lungs, and even vaping it can
Right.
irritate the lungs a little bit because that oil recondenses. Fortunately, again, it's non-adulterated. You could check the COA, so it's healthy and your body can absorb it. But an overindulgence in that is going to make you
Right.
cough more, which will irritate your throat more, and
Right.
your experience will be less beneficial, if you will. You won't want to necessarily do that all the time or be like, what am I doing wrong every time? So a quick inhale, breathe in, as you're exhaling, just start breathing normal. And each time you
Hmm.
inhale, you didn't get all that vapor smoke out. That's another ingress that you're getting with another absorption rate in your lungs, which is going to make that one hit or that one draw feel like five or six. And you'll save
Actually,
money, you'll save medicine.
Dr. Sulik calls that the secret breath.
Yep.
That right after you take a hit, you take another. Just take a breath, a breath in without any cannabis, and it really helps to make that more effective. Let's put it that way.
Hmm.
So something that's really really out there. We've kind of beat that one to death. You opened up Pandora's box. I'm sorry, but it's there. Let's jump into the next set of questions that are here. Um, what about vape pens that don't have temperature controls to get the most out of those vapes? Well, I tested basically batteries is the best way of putting it. from 3 different dispensaries. And what I found out is the temperature settings on those batteries were somewhere between 390 and 395 degrees on all 4 of them. Or it didn't make any difference. In fact, candidly, they were made by the same vendor, just different packaging. So you're getting to that high setting of vapes, which, if you really want to smoke and get the most out of THC, that's the way to go. But if you're trying to get the most out of the terpenes, that may not be the way to go. Your thoughts, Manny?
So I would agree with that, Mark. An easy way to describe these are the disposables that most dispensaries sell. The disposables typical are draw activated, so as soon as you inhale on it, it lights up. It's vaporizing the oil, and it's a 1 temperature setting. And they're usually, like you said, around 390 to 395. But they're doing that based off of the science of having your draw be the way it should be, rather than sucking on it. Like if you're trying to drink a milkshake, you don't want to do it in that method. You just want to take a little draw. You see it light up. You should feel the tingle in your throat, depending on if you're a mouth or throat draw. And then you should start feeling it in your lungs. And instead of holding your breath, exhale and start having your natural breath, and you'll get that effect. If you continue to draw on it too long, that's going to continuously overheat the oil. Even when you put it down, that oil is still going to go into it, and that's what's causing those clogs you may be experiencing. So it's about, if you want to get the most out of those type of pens or those batteries, small 3 to 5 second draws, 5 being even extreme, and just maintain your breath, and you'll find it more effective.
Claire asked a question that, Claire, you've got my attention. First of all, thank you for the thank you. Compliments get you everywhere. I really do appreciate that. And we work very hard, not just myself, but the staff and Leah and everybody work very hard to really make this a informative program that really helps people. Our goal is to help you get your life back. But you mentioned that you had total knee surgery about a week ago, and you've been liberal with the Tylenol, and of course they've given you opiates. And the opiates just put me out. It didn't really work. You asked a question of what do I suggested ratio of THC to CBD to reduce inflammation. I actually have a regime that I'm going to, next week in the dosing webinar, I'm going to actually show you what regime I actually used. But the answer to your question is, initially what I did was I had a ratio of, and when you say 1 to 4, the first number is CBD and the second number is THC. So I'm going to reverse the CBD to THC, so it's CBD to THC. I started with a very high concentration initially of THC to CBD. I was using a 4-to-1 and a 1-to-9 or a 1-to-4 product because I was really concentrating on the pain. And that was something that I used. I used it in a tincture form, and then I also was able to get it in some flour. Yeah, here we go. That's here. So what I did, literally right after the operation, what I had to pay attention to was in my regime was how long does it take, how long does the particular product work? In other words, if I take a vape pen and I get rid of the pain immediately, 2 hours later it's going to come back. But for those 2 hours, it gives me a chance to use a tincture drop, which may take 20 minutes or 30 minutes to work, but it'll work for about 4 hours. So what I did initially, and this is my routine, was I would get up in the morning and I would start with a THC vape. And this is when I first started out, high THC vape, take 1 or 2 hits, and literally within a minute or two, my pain level would drop down to from a 8 or a 9 to a 1. I mean, it was amazing, and it still does it today. And when it does it today, I'm still amazed at that. I then added a tincture oil, which in my particular case, because I was concentrating on, and this is right after the operation, the pain, I went to a 1 to 4 tincture oil. And I paid attention to the fact that it had myrcene, linalool, and limonene in it because that's what I was looking for the help of the pain relief. If I didn't have, so that was how I started out. And I'll talk about the first week or two. This is the regime I had. I'll talk about what I did after that, okay? In the middle of the day, because what would happen is the pain, this would wear off probably about 12, 1 o'clock, because I'd get up about 8, 9 o'clock in the morning. 12, 1 o'clock, I'd start feeling pain again. Again, I'd use the vape pen, and I went back to a tincture oil, but in this particular case, I used a 1-to-1, and I paid attention to the caryophyllene and the limonene because I had to work during the day, and I really wanted to pay attention to having a product that kept me awake, but also addressed the pain. And I found it to be very, very effective. And then in the evenings, I went to a high THC CBD pen as I needed it. And then again, I stuck to the 1-to-1 cartridges that were out there. Now, when I went to sleep at night, try to sleep overnight, I used I took some chocolates, and I used 5 milligram, a tab or two of the chocolates, and that really helped me there. And that's what I started out with. What I found out was that after a week or two, in fact, one night, what happened was I ran out of the tincture oils, the 1 to 4 tincture oil, and of course I couldn't go at 7 o'clock or 8 o'clock at night into a dispensary, so I used a 1 to 1 CBD product, and guess what happened? It worked just as well. In fact, that's where it says alternatively, after time, I began using a 1 to 1 rather than a 1 to 4, because here's what I found out. When I used the 1 to 1, it reduced the inflammation. And in talking to both my medical doctor and my medical marijuana doctor about that, by reducing that inflammation, it reduced the pain. And I know it sounds kind of counterproductive, but it was something that really worked. In fact, today I use a product that is more of a 4 to 1, 2 to 1, or 4 to 1, because I found it's more effective. A higher concentration of CBD helps me to maintain and to get rid of my knee pain. And of course, I do augment that today with topicals. So Claire, I hope this helps. This was what I did. I was able to follow this regime. I did make changes to it as far as how much I was taking. When I was taking, I had to pay attention to my dosing. But I did journal. I did write down exactly what was happening, and that's what caused me to pay attention to and really start using more CBD, because I found that when I used more CBD, my pain level after that was going down, and that was because of the reduced inflammation. So I hope that helps answer that question. Manny, you have any comments?
Yeah, I'd like to add just a little bit to that. I kind of helped my father get through a knee replacement. And again, I'll add route of administrations. You can use topicals with the vapes, as you're suggesting, Mark. But one of the things I really want to point out about this regimen, because I absolutely love it, is that the beauty of marijuana is that when you take it and you're actually mitigating your pain appropriately and effectively, it's not going to allow you to do more than you're allowed to do. I deal with a lot of consumers who are getting off opioids for their pain, and a lot of times they would re-injure themselves because they would forget how hurt they actually are during their recovery, because the opioids would distract them too much. It shuts off the sensors, whereas marijuana is actually going to help regulate how you're sensing things. So it won't let you go too far, because one of the biggest things you're obviously that you're going to have to do is maintain mobility in that knee. The exercises that you have to do to keep on bending it to get that range back, and to reduce the amount of scar tissue that you're going to have after the effect as well. The more scar tissue that develops, the more restricted you're going to be, the more pain you're going to be, and that's going to come with the inflammation and not being mobile. So managing, journaling, dosing properly is going to play a huge role. And then, of course, the routes of administration. Use topicals with orals, edibles, sublinguals, and or inhalation as well.
It sounds crazy, but my doc. Well, I went to a sports doctor. Okay, so I was not your average orthopedic surgeon. He operates on professional athletes and those folks. And his formula for me was stay as mobile as possible. Although you have a knee surgery and it's in pain, stay as mobile as possible. Move it. If you're in bed, flex it, move it, work on the muscles. The more you can do that, it goes back to what you're saying, Manny. If you can keep it flexible, it'll work very well after the knee operation. It's really there. Yeah, I think it's really important to point that out. Great. Thanks for the input, Manny. That's there. Do we have any other questions that have come up? Thank you. Again, compliments get you everywhere. Thank you very much. Is there a way that you can smoke flower without the smell? Hey, Manny, your thoughts on that?
So smoking flower, I would say no. There are devices out there that suggest you could blow through it because it has a carbon filter in it, so it eliminates the smoke and the smell. I've tested them because little backstory, my wife works for a medical marijuana doctor. However, she's super hypersensitive to marijuana. She can't even stand the smell of it. So I'm outside even during this cold weather and everything, smoking my flower or even vaping sometimes. However, since I've started vaping flower, using the stores in Bickle, she was impressed that she really couldn't smell it because it was vaping. It was combusting, or not combusting, but vaporizing the trichomes, which let out the cannabinoids, flavonoids, and terpenes, which the medicine got into my system, and what I exhaled or egressed out wasn't as potent because I was getting about 90%, I would presume, of the medicine absorbed. So that's the only way I would suggest that, tested by me, you wouldn't smell the flower after inhaling it, is by vaping it. But so-called, there are devices out there that are supposed to help. I haven't found one yet.
Well, look, if you buy a quality cannabis product and you light it up, it's going to smell. Okay, that's what you bought. I mean, you bought that, and there's no way of avoiding that. I think your advice is correct. Using a dryer vaporizer removes a lot of the smell that's really out there. And I think that, I know in my house, for example, my wife is very sensitive to cannabis, and when I use cannabis at home, I prefer a dryer vaporizer. In fact, I recently went through. I'm doing a little background. I'm going to do some videos on how to actually use medical cannabis, and I've been experimenting with it. And I'd never rolled a joint, so I got into rolling joints about two months ago, and trying joints versus dryer vaporizers. And boy, I didn't realize there was such a great big difference. I mean, I would go dryer vaporizer 10 times out of 10. I mean, just because of the quality of the taste, the fact that it works a little bit better, and candidly, I don't know how to roll a joint. Okay, is the best way of putting it. So I don't have to go through the embarrassment of coming up with these joints that Cheech and Chong would laugh at. Let's put it that way. So, well, Manny, we're going to wrap up a little bit. Do you have any final thoughts on terpenes?
Well, just like I said, terpenes is one of my favorite subjects. You can always reach out to us. You can always reach out to me. I'm on staylifted.life, and I'm still providing consultations. They're free. I'm just trying to help people. I hope we were able to reach some people tonight and get them some assistance. And if not, and if you know anybody who might be interested, direct them. Let's get people on board and get them the relief and quality of life they're looking for.
Yeah, I think a lot of people always ask me a question, where do I find out information about medical cannabis? That's one of the reasons I put this together, because really they're asking a question of, how do you help me get my life back? That's what they're really asking for. And I think you're one of the people that do that. And that's why I put you on the show and want to really promote your program, because you do a great job of that. A lot of people really need help. And I know, especially you've done a lot, just I'm going to compliment you. You've done a lot with not only veterans, but also with the police forces to educate them.
Yeah, I've done a few seminars with the local police. I'm still trying to crack that nut to get to the sheriff's office. It's a little bit more difficult. I think they're coming around, but it's all about sharing that knowledge, getting the people that the quality of life they deserve and are looking for and seeking, and getting them off with these pharmaceuticals. That's not to say pharmaceuticals don't have their place. I know they do. I use them still myself, as I'm exploring with marijuana and as the world is still. But there is a better way to manage and take care of yourself, just rather than just going through the pharmacopoeia.
Sure. Well, Manny, I want to thank you very much for helping me tonight. I look forward to working with you next week on dosing. That's between terpenes and dosing. Those are kind of our top two favorite subjects.
Absolutely. I'm looking forward to it as well, and always grateful to be on the show.
Thank you. I also want to point out, if you're looking for a quality dispensary, Air is our sponsor, but it's not just that they sponsor; they do a great job. That you've noticed today, they have that handout for the terpenes. They have terpenes on their website. They do a great job of letting you know what's out there, and they have quality bud tenders that have been trained. And I think it's something to really pay attention to. And they have a number, at least not only here in Florida but in other states. They have a number of dispensaries to really take a look at. If you're looking at getting a medical marijuana card, I recommend Medical Marijuana Treatment Clinics of Florida. There's 22 of them throughout the state. And I think the thing that separates them from everyone else is everybody can get you a card. Once you get your card, what do you do with it? They have a journey, an email journey that they walk you through that helps you every 2 weeks understand how to get the most out of your medical cannabis. They have a call center that you can call with any questions, and they have a dosing center. So you get support. And that's where they differ from other medical marijuana doctors. Not that the other medical marijuana doctors aren't good, they are. But the problem is they're by themselves. And so by being able to pull the 22 clinics together and put together call centers and things, they're just able to provide a better product for the customers, and that's why I recommend them. Now, the other thing I'll point out is, shamelessly, patient education. Please pay attention to our webinars. Please join us next week, not only for dosing, but the week after for arthritis. After that, we're going to be talking about neuropathy. And then in the middle of March, I'm going to do one on weight loss as well. And then, of course, naturally, check out our YouTube channel, Marijuana Aware. It's growing, and we like to get a lot of information to you and be able to provide the quality of information to help you get your life back. Thank you, everyone, for joining us tonight. I really do appreciate what you're doing, and I look forward to having you join us next week for the dosing webinar. Thank you.